So I remember this lady who, she actually came to see me years ago before we had stents. We were doing balloon angioplasties, but we weren't doing stents. So stents are what we call the great equalizer. Because in those days, you could have a balloon angioplasty and the vessel could just collapse down and you're in trouble. You never got anywhere as a result. So only very few doctors could do those successfully. And so hence the stent became the great equalizer. A lot more doctors could now open up arteries and they would stay open. So this lady, she had had previous bypass grafting. And as you know, once you get a bypass graft, the chest, inside the chest becomes real scarred down. And it's much more difficult to do a cardiac bypass operation. It can be done, but at much increased risk. It's a fourfold increase in risk at least. So this lady came in and she had symptoms of chest pains, and this led to, after investigations, led to a heart cath, which showed that she had two vessels which were critically blocked up of the three main vessels of the heart. And we said there was no question of her going for bypass surgery because this lady had recurrence of cancer. And she had a colonic type cancer, and this was now metastasizing, and she was not going to be a candidate for complex surgery such as this. So we talked with her. I talked with the interventionist, and we told them she wanted to go ahead. We said, remember, in those days we needed backup surgery because if the vessel collapsed down, then you had to rush to surgery. And there would be no backup in her case because she was so difficult to go into with her previous bypass. So she said, yes, I want to go ahead. I want to go ahead. And I said, sure. So I went ahead and we opened it. It was a very difficult tunneling operation. And we got both of her vessels opened. And that lady had about 11 children. And the 11 children got together, bought her a huge motor home kind of thing. And she set her up in the motorhome, and she would travel all across the country to all the weddings, the births of all her children, grandchildren, and great-grandchildren during this time. All this time, her cancer was spreading. During this time, she came back after a year and a half or two, and we did another angioplasty on her, which worked, and she went. And then one day I'm in the office after 3 years now, and her daughter, the one that always came with her to the clinic, she came up and she said, I think Mom wants to talk to you. I think she's getting ready to go. She's over in the cancer ward. So I said, yes, I'll go over. And I went over there, and there was this lady. She was dying. She was skin and bone. Her mouth was open, and she just was white as a sheet. And as she saw me come by, she turned her head a little bit, and she smiled, a bright smile, and her eyes just lit up when she saw me. She couldn't say very much, but we talked to each other, and a few days later she died. But I thought that was a hugely successful thing because the 3 years that we gave her to continue her life and to meet up with her were so full. I cannot think of that as being wasted medical effort. I think this was really adding value to life.